you're going to tell them on page 14, 16, it talks about the changes associated with aging. A big one for the elderly, like as they're aging, is that the pubic hair will turn gray or thin out. Okay, so they won't have that thick pubic hair. And a lot of times when they age, a lot of patients will come in and say, "Is there something wrong? Like, is that it's alarming to them." You just want to tell them that's a normal finding. All right, and then pelvic examination is done by the healthcare provider. When a woman gets a pelvic examination, what position is she in? What is it called?
No, with the legs up.
Legs up.
The frog.
The frog. Everybody's looking at me like this, as if they're praying. It's called lithotomy, guys.
Yeah.
What? Lithotomy. Lithotomy, that's the name of the position. Yeah, lithotomy. When you put the legs on the stirrups, and you have to, they examine, they're putting the patient in lithotomy position. Our job is, we can't obviously do anything invasive, but we can inspect the outside. Okay, so for symmetry, things like that. Now, if I'm not trying to be weird or whatever, but like if you see like stuff coming out of the vagina, and you can take a sample of it. Obviously, you're not going invasive, but if it's, sounds gross, so gross. If it's dripping coming out, you can take a Q-tip and swab it. Okay. And what would you see that in? More of like people with what? STDs, yes. STDs, you would see that. Benign breast disorders. This happens very common. Young girls come in, they want to know why I feel a lump in my breast or something like that. They may have like fibrocystic breast. Okay, so they have atypical hyperplasia. They can have a fibroadenoma or fibrocystic changes and cyst. Okay, and some women's breasts literally have a lot of fibrocystic changes. Okay, they feel it. They automatically feel something, but when they do a mammo, it's all fibrocystic. Oh, I thought you were going to answer. All right, so fibrocystic changes and cysts. So these affect at least half of the women over their lifespan. You have premenopausal women between the ages of 20 and 50. They may have pain or discomfort, and it's caused by an imbalance in estrogen to progesterone ratio, and it does not increase their risk of developing any cancer. Remember that cysts are spaces filled with fluid lined by breast and gland, like mild analgesics, so Tylenol, Motrin. You want to limit the salt intake. What does salt do to your body? Fluid retention. Ice or heat. In this case, it all depends on what they prefer. Okay, if they say like, oh, the ice, makes me feel better, or some women, I've seen more women say that the heat makes it feel better. Okay, and then draining of the cyst. So, are they going to do a needle biopsy, or are they going to go in and do an incision and drainage? Oral contraceptives or SERMs, they suppress the oversecretion of estrogen. Also, a big one that you want to teach for interventions, you want to tell these women that they should be wearing. You want to teach these patients that are on oral contraceptives that they have to take their meds. So think about oral contraceptives. You guys learned this in pharm, I'm assuming. The women that are on oral contraceptives have to take the pill every day on the same time. Okay, if they skip a dose, they cannot double up on a dose. Okay, and another thing you want to teach these patients is to feel their breast. Okay, they should be doing after their menses. I usually tell them do it in the shower because it's the place where they're alone. Hand over the breast, going in a clock motion, okay? Or they could do it while they're laying in their bed as well. You want the hand over the head, whatever, let's say it's the left breast, right breast, okay? Breast cancer. All right, so with breast cancer, hold on one second. All right, so breast cancer is cancer of the breast. It's originating in the breast. So breast cancer is the leading cancer in women in the United States. 1 in 8 women will develop breast cancer in her lifetime. Just terrible. Early detection is important for to successful treatment. The risk factors include if they have a positive family history, menarche before 12 years old, and menopause after the age of 50. The menarche before 12, and the menopause after 50. All of them. If they're nulliparous, and those bearing their first child after 30. Well, now it's very common because a lot of people wait now to have kids, If they have a history of uterine cancer, daily alcohol intake, and the highest incidence are those age 40 to 49 and over 65. So with the breast cancer, it's generally an adenocarcinoma. So it originates from epithelial cells, and then it occurs in the ducts and in the lobes. The tumors tend to be located in the upper outer quadrant of the breast and are more often in the left breast than the right. Let's keep going. So with this non-invasive in situ breast cancers, you have ductal carcinoma in situ and lobular carcinoma in situ. So the ductal, it's in the duct, lobular, it's in the lobe, okay? With invasive breast cancers, it originates in the mammary ducts and break through the wall of the ducts into surrounding tissue. Fibrosis develops around the cancer, and then this is one of the late signs is that the orange. It's when the breast changes its look, and it looks like everybody knows what an orange peel looks like. Okay, it has that orange peel appearance. Literally, the whole skin, the whole breast changes. It's so crazy. So with this, early detection is important. Okay. So every woman should be familiar with how their breasts normally look and feel, and should immediately report any changes to the healthcare provider. Okay, remember, teaching is important with this, especially if you have like an adolescent girl that's just like getting her period. You want to teach them, to look at their breasts, how to do a breast exam, things like that. A mammography is very helpful in the early detection of cancer of the breast. So a baseline mammography at approximately 35 to 40 years of age. That mammogram every 1 to 2 years between the ages of 40 and 44.
Every 2 years?
Every 1 to 2 years. And then they will get an annual mammogram for women between the ages of 45 and 54. So if you remember at 45, reverse it, 54. Like I told you